at the end of each day, you can look back and say, what have I done today? How have I helped others? How have I improved myself? If I have done this, there is a sense of accomplishment. And this is a tremendous satisfaction.
It's a real privilege for me to have all of you here. This just means more to me than you know, because I'm extremely proud of what you have done.
I'd like to give you a little historical background, because I think to understand what's happening today, you have to know something about the background of this clinic. For 2 years, I was just a salesman trying to sell this idea, to have not only a court of last appeal in the Deep South, where the difficult case could be taken care of, but also an institution that showed courtesy and consideration not only to the patient, but to the family. And this latter was a new concept. When we opened this hospital, it was the most modern hospital in the world at the time. We had the first recovery room any hospital ever had. And we had the first family lounge. These were innovations that were new in hospital care. Good morning.
Good morning, Doctor.
How are you?
Pretty good. How are you?
You look fine. I'm so
Feeling pretty
pleased.
good this morning.
Well, you're great.
Feeling
Won't
fine.
be long before you'll be going home. So I saw that the only way that one could reestablish New Orleans as a medical center was to have group practice. It's the best way in which one can practice good medicine better, more reasonably. And I've always maintained that a group practice is important only because people work together as a team. And this is the reason why it takes an unusual group of individuals to be in group practice. Medicine is like the clergy. Our work is a service. And unless one goes in to medicine with the idea of giving a service, he shouldn't do it. A lot of my friends worry about my working hard. I put in long hours, but no one has as much fun as I have. From the time I get up in the morning until I go to bed at night, it's not work, it's fun.
He spent as little time in the so-called necessities of life, eating, sleeping, as anyone I know.
He was what has been described as a master surgeon, in the sense that at no time in an operation was he not master of the situation.
Let's say front man. And whenever Ochsner got an invitation to go someplace and talk, by gosh, he was there. And the only thing he enjoyed doing more than making one talk was making two talks.
I consider you a special group, you are. At the foundation, we have many more applicants than we can possibly take. And as a result, we get the cream of the crop.
And I'm extremely grateful to you for your efforts. It's the greatest tribute that could be paid anyone to have men of your caliber honor me the way you have.
A lot of people say to me, they ask me if I wouldn't like to start over again. I said, no, I've lived in the most golden age of medicine. And I'm the most fortunate individual to have lived at this time. And I don't believe that if I had to do over again that I'd do anything different.